Well, only if you were a fly on the wall or a fly on the brain of the president, you would know what the Illuminati are actually doing. Actually, I'm going to point out a couple things. I know there's people out there that dramatize things left and right about, Alex Jones is a big name that dramatizes all kinds of things that are possibly going to happen, and how there's going to be more government control and everything, and Obamacare is one issue, and is it affordable health care or is it a total control? Now, actually, I want to present something. This is an older study, and I'm going to reference a couple links because actually I did one just on hospice, and one of the biggest abusers of a hospice happened to be from a facility in Mobile, Alabama. And I also did a video previously on a, basically it was not exactly a jail, but it was for the mentally ill and the horrible conditions that existed there. Actually, some of this stuff seems to exist worse in the South, but it could also be in the major big cities too. This was the Rosenhan experiment, actually conducted way back in '73. But since this time, things have gotten a lot worse. But I just want to point this out to people because this goes to show you that psychiatry and psychology is not really an empirical science. It's all subjective, and they make lots of mistakes, and actually they do more harm than good. Now, the problem is with this type of stuff is that it permeates every aspect of every person's life, because it's not only, it's depends on what state you're in. It could be DIFUS, the Department of Family Services or whatever, and or Department of Children's Services in other places. Depends on what it's called, but the state has control of children, and they could forcibly drug people because they're a little rowdy or something, and different things like that. Now, this was conducted, 40 years ago. This is 1973. So, and then since this time, it's gotten worse. But I've actually just showed you a picture of Obama, but I'm not trying to get political here because I didn't vote for this guy either time. But I just want to say that this Obamacare is not really presented by him per se. It's actually coming from the elite. It's a method of total control. And actually, if you look at one of the major whistleblowers during the time of the Gulf War and what was going on in Iraq and the weapons of mass destruction and the chemical weapons and what happened to one of the whistleblowers under the Bush administration, they had him put in a mental facility. You see, that's a lot easier to do than to incarcerate somebody for actually breaking the law, because, see, a mental facility, it's very, very, very subjective. And this is going to be the way they're going to control dissidents, because actually the way they, if you look at the United States today, there's more people incarcerated per capita than any place in the world. But if you look at China or something like that, in China they actually have, work camps, labor camps. They're not really incarcerated, re-education camps. It's almost like you're not thinking right. But just to show you just how bad a pseudo-science this is, this was a Rosenhan study was done in 2 parts. The first part involved the use of healthy associates. Basically, they're fake patients. They were perfectly healthy, 3 women and 5 men, 8 people. They feigned that they heard stuff. They had, they were hearing things. They had hallucinations of hearing things, and they wanted to get admission into 12 different psychiatric hospitals in 5 different states and various locations in the United States. So they all got admitted, and they all got diagnosed with psychiatric disorders, even though they were faking it. The other part of this study involved, they wanted to challenge the hospital to try to find who was in there to investigate them. And it turned out, out of 193 new patients, the staff identified 41 as potential fake patients. And 19 of those received suspicion from at least one psychiatrist and one other staff, and other staff member. In fact, Rosenhan had not sent one person to the hospital, so they identified 41 people out of 193 new patients as possibly being fake patients, whereas Rosen didn't even send anybody. So that tells you a lot about this pseudoscience. It's garbage. But, my point is, when people like the big names out there, Alex Jones and stuff, are talking about, oh, yeah, they're coming there, this is how they're going to do it. Very slow method. They could do a lot of stuff with this garbage, and they can. You see, if you're deemed mentally incompetent, you basically lose all your constitutional rights. See, and that's another way they can go around the whole system. It's evil as all hell. And I'm going to tell you right now, actually, if you hear of anything like this where children are being abused by the state, children are being rounded up because, they were forcibly given drugs by the state, people stick together, parents stick together, and fight them. You could do that in a lot of different ways. It's like when you say it's not my problem, then it eventually may become your problem. That's the problem. People got to stick together and fight for what's right. But this actually occurs a lot more it occurs everywhere. It's large cities and in the South. Some of the biggest abuses, actually, I think, in the mental wards or whatever it was, it was basically for a type of prison for mentally disabled. Some of the big, it was in Mississippi, I believe. I'm going to put a link down to that. And also one of the biggest abusers, and nothing to do with mental conditions, but also, things run by the state in Mobile, Alabama. Because once things are reimbursed by the government, there's no incentive for them to do right. They don't care. They're worried about their rating. They're worried about, how they impress, who's paying them. And who's paying them is not the people that's in there. It's the state themselves. So it becomes a revolving door. And actually, these institutions become an extension of the state. So what happens then? What happens? It becomes like totalitarianism and, trial without jury and all this type of stuff. Trial without laws, trial without evidence. Because, it's been proven time and time again. This is even 40 years ago, but it's gotten worse. It's gotten worse. So Rosenhan himself and 7 mentally healthy associates called pseudo-patients or false patients attempted to gain admission to psychiatric hospitals by calling for an appointment and feigning that they heard things, feigning auditory hallucinations. During the initial assessment, they were claimed to be hearing voices of the same sex as the patient, which was often unclear, but they seemed to pronounce the words empty, hollow, thud, and nothing else. These words were chosen as they vaguely suggest some sort of existential crisis, and for the lack of any published literature, reference them as psychiatric symptoms. In other words, they chose words that weren't even in the books. But still, they got to admit it. So they had no other psychiatric symptoms were claimed. Still, they got to admit it. The pseudo-patients were instructed to act normally if they got admitted, and they did get admitted, and reported they felt fine and no longer heard voices. Hospital records obtained after the experiment indicate that all fake patients were characterized as friendly and cooperative by staff, but nonetheless, they were all identified as having problems, manic depressive psychosis, it says, despite constantly and openly taking extensive notes on the behavior of the staff and other patients, in other words, they were in there investigating them, none of the fake patients were identified as imposters by the hospital staff itself, although many of the psychiatric patients themselves seem to be able to correctly identify them as imposters. So who the hell's the crazy people? Does that tell you something? And, in the first 3 hospitals, 35 of the total of 118 patients, expressed, a lot of people probably didn't say it, but they probably thought it, expressed a suspicion that the fake patients were sane, and some were suggesting that the patients were researchers or journalists investigating the hospital. But, the people working in a hospital couldn't figure this out. The patients figured it out. So who has more common sense than, it tells you something. But the point I'm making is the system itself, especially when it goes to affordable health care and it becomes more government control, this is how they're going to control dissenters right there. Because it's like a pseudo-science. They can label you anything and destroy all your constitutional rights inside of a heartbeat in no time at all. Also, one nurse, who I'd say is a nut, labeled the note-taking of one fake patient as writing behavior. In other words, a writing behavior problem, and considered it pathological. He was pathological because he was taking notes. And that was according to the staff and a nurse. And so, not the staff, actually a nurse. A trained nurse, I'd assume, because when you're a nurse, you actually go to school to understand medical terms, and you have a background. You're not just a staff member. So that was talking about a nurse. So Rosenhan and other pseudo patients reported an overwhelming sense of dehumanization, severe invasion of privacy in the bathrooms and all that stuff, and boredom while hospitalized. So in other words, actually what you're supposed to do in these places is actually uplift people's self-worth, give them hope and all this kind of garbage, and stimulate their mind. So they're doing the exact opposite and making any condition worse. So this is all actually paid for by the state, and for most cases, and this is what they'll do to people's children and things like that. So what I'm pointing out here is that this is the actual biggest danger behind the Affordable Health Care Act, or whatever you want to call it. They called it Obamacare. Now, 30 years ago or so, they called it Hillary Care. It was defeated. You know, if Hillary Clinton becomes president, and if she gets on the ticket, she will become president. I hate to say that, but she will, because there's enough people that would vote for her. You know, Benghazi was just a figment of your imagination. That's what most people will say. But anyway, claimed that the non-existent imposter experiment claimed that similar events, in other words, a lot of institutions said, oh, that can't happen by us. You know, we'll figure that out. You know, so they claimed that no error like that could happen at their institution. So Rosen arranged with them that during a 3-month period, one or more pseudo-patients would attempt to gain admission, and the staff would rate every incoming patient as to the likelihood they were an imposter. Out of 193 patients, 41 were considered to be imposters, and further 42 were considered suspect. So you're talking about half of them they suspected, at least, right? Approximately half. In reality, Rosen had sent no false patients, and all patients suspected as imposters by the hospital staff were ordinary patients. So, you know, it's just from 40 years ago, but, you know, the problem is nothing has changed. Nothing has changed. But my point is, and actually I have a couple related videos on that. One is, one is actually an institution. I think it was in the Mississippi. And actually some of this stuff seems to occur more in the South. I think it's the plantation owner mentality, like the, what do you call it? The, they used to be the slave owners, and they used to be the plantation owners, and they have this good old boy network, and it's all hooked in with the state, and you got Uncle Tom over here, you know, playing up to the stuff, and that's so a lot of this type of attitude is prevalent in the South, and I've got instances where I talked about Mississippi, where they had horrible conditions, where even they're getting paid, you know, they're getting paid to take care of these inmates with supposedly psychiatric problems, and non-flushing toilets, freaking rats living in the place, rats they were using as pets, rats they were selling to each other as rewards for pets, extreme filth. And also, you know, this goes on even in the state-run institutions, because even in a way they're not state-run, but they're reimbursed 90% by the Medicare system in care of the elderly, too. So, you know, and actually where they actually destroy a lot of people's cognitive function is through the drugs they give them, because even pain management drugs for hospice can destroy your cognitive function, you know, your sensory awareness, and, you know, your brain function. So here's a fly sitting on the president's head. I don't know who is more intelligent or who is more the insect of the elite. It's very difficult to say, but only the fly knows what he's thinking. So, you know, or only the fly knows the deal. Because actually, you know, like, people are panicking about, the Department of Homeland Security. And yeah, there's a problem with that where it's unconstitutional. But actually, this Obamacare is actually going to be the biggest thing. It's a slow process. It's been going on a long time. And, yeah, you know, it started out with Hillary Care, and it was defeated. And now it looks like it's defeated again. But, you know, people are looking at the money angle, but they're not looking at the control angle. Because actually what's going on is that there's a lot of control of people's children going on through this fake, pseudo, non-empirical science called psychiatry. You know, they can actually have a child go to somebody and say, they're normal. One will say there's this problem, that problem, this problem. And there's a financial incentive for them to say there's a problem because they sell drugs. Because psychiatrists are nothing but drug dealers. And, you know, actually I've pointed out a number of videos that there are actually natural methods for people who have problems to get well. And some of these natural methods are, some of the simplest, cheapest things going without even using something more complex like the electronic biotuner. But still, even that is way less money than, the costly psychiatric drugs. Back in the day, they used to use, they used to try to raise the ketones in the brain by using high ketonic diet, which one of the main ingredients of that was the coconut oil, because of the it actually raises the ketones in the brain a lot. But actually, this study from 40 years ago, still being ignored today, is proof positive that the psychiatric profession doesn't know what the hell they're doing, yet they get reimbursed by the government. They get highly paid. They're drug dealers, and this profession is all going to get wrapped up in with state and federal government control, and where it's actually going to be where dissidents are going to be labeled as having a disorder, and there goes your constitutional rights. Because if you're labeled as having a disorder, you're done. You're done. You do not have, you'd have to have some attorney or somebody else evaluate you that, everything's fine. But if you don't have the funds to do that or the backing to do that, you're screwed. You're screwed. So, this is actually the biggest danger to some of our freedoms in the United States. It's actually a slow, small, different way of doing approach. It's not the jackbooted Nazi approach that Alex Jones likes to put out there. But, it's not full frontal assault. It's not super obvious. But, this actual pseudo-patient, false patient experiment has shown that the psychiatric profession does not know what the hell they're doing. And they're in there for money. And, actually from my understanding of a lot of people that are in professional fields, like this actually is one of the worst professional fields going. Very narcissistic, very money orientated. Psychs will get in $250 to $500 an hour in some cases, and they're screwing people up. So, and actually when you figure it out, that the overall GDP calculations, when they say the economy is doing good, a part of that economy is probably just going right to the pockets of the psych profession, who are destroying people's lives with drugs, which actually, the sale of more drugs, psychiatric measures and medicines actually goes into the calculation of the gross domestic product. So, that's the way that numbers sometimes don't mean anything. But I just want to point this out. I'm actually going to show a couple links to a couple other videos I had, several other videos I had actually about some solutions to this, and actually some of the problems that are out there too, because this is one of the biggest dangers going, big time, big time. And this clown up here with his fly on his head, he's just a tool of the elite, and that's all that game is. And we got to watch out for government encroachment in a lot of different ways. Some places are not as obvious as others. Not to dramatize this too much, but it is a danger. I personally can't stand the psychiatric profession because they cannot measure in any real rational way or any scientific empirical way whether a person is sane or not, and for the most part. And unless it's quite obvious. And if it's quite obvious, you don't need a degree or a PhD or $550 an hour to figure out if a person's crazy or not. If you see a person walking down the street and they're talking to themselves left and right, or they're walking into trees or whatever the hell they're doing, you could say the person's crazy. You don't need to be a psychiatrist. And when it becomes obvious, then it's true. But, in their case, they take normal people and they will label them crazy and give them drugs because it's profitable to them. And this is the Affordable Health Care Act at its worst.